Hi, it's Dr. Ray. So there are two perineal spaces, commonly referred as pouches, that you should be aware of anatomically. And essentially these are two regions of the perineal part of the body that have separations of that are separated by fascia, and there's certain contents that exist in each of these spaces. And so if you are going from most superficial to deep, you can see I've drawn in here skin, and you can see the subcutaneous fat underneath the skin. And then you have that membranous layer of subcutaneous tissue called Colles fascia. And then you have structures that exist between this Colles fascia in the perineal region and the next fascial plane that's called the perineal membrane. So this space between Colles fascia and the perineal membrane is called the superficial perineal pouch, or superficial perineal space. If you go deep to the perineal membrane, there's another potential space for extravasated fluid and infection to accumulate, and this is called the deep perineal space or pouch, and that is going to be the potential space between the perineal membrane and the pelvic diaphragm, most specifically the muscular fascia that exists on the inferior aspect of the levator ani. So here you can see this in the figure with structures on it, that the superficial perineal space is going to have all of these structures in the male and the female. So the erectile tissues are going to be there, the overlying muscles on top of the erectile tissues will be here, the openings to the urethra and vagina in the female. In the male, you're going to have the bulb of the penis, you're going to have the crura of the penis, and you also have the superficial transverse perineal muscle in both sexes. So what specific structures exist for the male only? It would be the bulb of the penis and the crura of the penis, because you're going to have the clitoris in the female, and their overlying muscles. And then you also have the proximal part of the spongy urethra that's going to be in this area. And the other structures like Gallaudet fascia and Pudendal vessels and nerves that aren't depicted here on this image are going to be present in both sexes. For the female superficial pouch, you're going to have the crura and the bulb of the clitoris. You can see this little yellow dot here, that's going to be the greater vestibular gland, also known as the Barthenian's gland. And here you can see they cut off the muscle so that you can see that this would be the bulb of the vestibule, other cavernous tissue that exists in the female. And then the overlying muscles and the neurovascular structures that aren't depicted in this image. And I want to point out to you that the deep pouch, so if you take off the perineal membrane, you can see that you're looking up at the floor of the pelvic cavity, and there are some structures that actually exist in this space, and the space can fill with fluid or blood and actually make the space even bigger, and it can impinge upon the structures in this area. You can see that the neurovascular structures that are coursing and going towards the dorsal aspect of the clitoris or penis are going to course through this deep perineal space. Here you can see the membranous part or intermediate part of the male urethra is going to course through the deep pouch or deep space, and you can see the bulbourethral glands are situated. Also, the external urethral sphincter is actually going to be in the deep space for the male and the female, and the deep perineal transverse muscles. So here you can see the deep muscle and its positioning in the deep pouch or deep space. And I wanted to point out clinically, it's important to know that the ischial anal fossa, if you have, like for example, they're showing pus here, you can see that it can actually go anteriorly underneath or really superior to the perineal membrane and get into the deep perineal space. So both sexes in the deep space have the part of the urethra is going to pass through, is going to have an external urethral sphincter and the anterior parts of the ischial anal fossa like I showed you in the last picture. In the male, you have very specifically the intermediate part of the urethra and deep transverse perineal muscles here that are skeletal muscle. So they have a different autonomic innervation, different innervation compared to the female one. So that is a little bit different. You can see it depicted in textbooks. They don't always agree on how they describe the deep transverse perineal muscle in the female. And then here you can see bulbal urethral glands that are going to be in this deep space, and the neurovascular, which these structures going to the dorsal aspect of the penis. In the female, you can see a nice view from Netter's Atlas, and you can see it does look a little bit different. The deep transverse perineal muscle is made of smooth muscle, and there is a urethrovaginalis muscle that actually goes around like a sling around the urethra and the vagina, the walls of the vagina here. The greater Barthonian, greater vestibular glands are going to be in this space, and the external urethral orifice is going, well, really the urethra is going to pass through it. The external urethral sphincter is in this space, and the orifice is opening into the vestibule. So they have it depicted there, but it's not, the orifice is going to be in the superficial space. So you can see it does look a little bit different with the musculature. There's a lot more elaborate musculature in the deep space of the female, but you're not expected to know the urethrovaginalis or the compressor urethrae muscle. But if you go into this field, you're going to want to look into this area further. And here you can also see the neurovascular structures coursing through this deep space to be able to make it to the dorsal aspect of the clitoris that is not depicted in this image. Okay, so then I had a question for you in class. So if this is how this kind of information is depicted in question. So if you had a fracture at the pubic symphysis and it causes a rupture in the intermediate part of the urethra, where would the urine be likely to accumulate? And so if you ask yourself where that would be, see if I can put my check marks on here. It's actually in the deep perineal pouch or space, because that's where the membranous portion of the urethra is located at. But it can also go up into the pelvic cavity through the hiatus, the urogenital hiatus. And so you should be aware that that can also occur. So the concept of the deep perineal space and all of this layering is relatively new. It used to be referred to as a urogenital diaphragm. And so you might hear clinicians talk about this area having a urogenital diaphragm. But really now we talk about these spaces being limited by these fascial planes. So Colles fascia to perineal membrane, and then perineal membrane that is going to go up to the inferior fascia on the levator ani. And that's sort of the extent of these fascial planes that you're looking at here. And it's important to know that this perineal membrane is actually the last support, passive support of pelvic viscera. And so, you know, this is the membrane here in blue, and that's going to be sort of the last passive, I'm sorry, it's going to be this one in blue, and it's going to be the last support that the viscera have after the floor of the pelvic cavity. So I like to, I want to point out an indiscrepancy amongst materials that you have. If you look at the Grancis sector, it doesn't name any of the pudendal nerve branches, but if you look at some other figures. They give names to superficial perineal and deep perineal. And the only ones that really you need to be aware of is the pudendal nerve as it courses through the ischial anal fossa. It is going to divide into branches that are going to bring innervation to the superficial space or the deep space for sure. Although some textbooks will also talk about the dorsal nerve of the penis or clitoris giving off branches that go to structures in the deep space. So you don't have to know different branches of the perineal nerve, superficial and deep, but you should be aware of the dorsal nerve of the penis and the clitoris, and essentially the rest you can just call the pudendal nerve. Here's an example of that. Here's that I got from the Netter Atlas, and you can see sort of the pudendal nerve, and then when it approaches the perineal region, they call the perineal nerve, and then you can see they divide and they sort of like just point at them, and they say deep and superficial branches, and they call it that's sort of, it's just transitioning the name pudendal to perineal. And so I just wanted to use this as an example and make you aware of the fact that not all resources are going to agree when they're talking about the branches of the pudendal nerve. And that's it. If you have any questions, feel free to email me, and thank you very much.